Health education. Health means your physical, mental, and social well being, and not just merely the absence of disease or infirmity. And education refers to the process of imparting knowledge. So, health education is nothing but the process of imparting knowledge such that the person is able to maintain, promote, or restore their physical, mental, and social health. Again, what's the definition of health education? What exactly do you mean by health education? It is the process of imparting knowledge about health. However, this is not the definition you are going to write in exam. That's your layman definition. The definition given by John M. Last for health education is: it is a process by which individuals and groups of individuals they learn to behave they learn to behave in a manner conducive to: number 1, promotion; number 2, maintenance; and number 3, restoration of health. Okay, what does this even mean? This long ass definition that I got here. This is what it means. Health education is the process of giving knowledge. Knowledge to who? Knowledge to one person, or maybe a group of many persons. Knowledge about what? Knowledge about health. Knowledge about what to do with health. Either to maintain health, means to maintain health, to promote health, and to restore health. Now, the question is, what's the difference between maintaining health, promoting health, and restoring health? Maintaining health means keeping your health status as it is. Promoting means increasing your health status, and restoring means bringing it back to normal. For example, so this is a graph that I have drawn right here. On x-axis we have time, and on y-axis we have health status. Let's say a person is normal or is not suffering from any disease. He maintains his health over time. This is what we call maintenance. Let's say the person brings changes in lifestyle, such as the health status elevates or increases over time, and then he maintains the increased health status. This process of elevation, increase in health status by the change in lifestyle or by following healthier lifestyle is promotion. Maybe the person suffers from a disease and now he is in an abnormal condition. So the person brings his health condition back to normal. This is what we call restoration, and then maintains it. Or maybe goes further on and promotes his health and then maintains it. So basically, there are three terms: maintenance, where the health status is maintained over time; promotion, where the health status is increased by bringing healthy change in lifestyle; and restoration, where the health status that has decreased from normal is brought back to normal. So, health education basically teaches people or group of people or individual person how to restore health when it's Greco, when it's bad, how to maintain health, and how to promote health. The following are the objectives of health education. Number 1, to encourage people to adopt and sustain health promoting lifestyle. If a person adopts health promoting lifestyle, this will help in the promotion of his health status. If a person sustains the lifestyle that he has just adopted, then he will be able to maintain that increased health status. So, after adopting healthy lifestyle, promotion of health; after sustaining healthy lifestyle, maintenance of health. To promote proper use of health services like what? Immunization, health insurance, public gyms, complete body checkups. To improve skills that lead to promotion, restoration, or maintenance of health, like personal hygiene skills, brushing, hand washes, all that itty bitty stuff, exercising, healthy cooking, Jivan Bigyan. All these skills help person promote their health or maintain their health or even restore their health. Change attitude, like stop smoking. If a person stops smoking, I have already said this story before, there's less prevalence or probability of lung cancer, better health status, higher life expectancy. Start daily exercises, care for one's mental health, which is quite important, start eating healthy. So the objectives of health education is three things: to promote health, to maintain health, and to restore health. And this can be brought about by doing by these following objectives: by encouraging people to adopt and sustain healthy lifestyle, by promoting the proper use of health services, by improving skills, and by changing attitude. So these various stuff, they help in these three stuff. Okay, then there's content of health education. Okay, you are there, you are giving health education to a person. So what are the various things that should be compulsorily there while imparting knowledge on health? These are the various contents of health education. First, human biology. Obviously, you need to start from the basics. First, you need to tell the person about his or her own body, how to be fit, what's the role of exercise, what's the role of rest, what's the effect of alcohol and smoking on body, what's the effect of following bad habits like alcoholism and smoking, about reproductive biology like importance of child spacing, importance of breastfeeding, safe motherhood, weaning, immunization. All these facts about human biology is the first thing to be mentioned while imparting knowledge on health. Second is obviously nutrition. Good food leads to good health. So, what's good food or what's a balanced diet? Then, hygiene. There's your personal hygiene and environmental hygiene. Personal hygiene keeps personal health healthy, environmental hygiene keeps environmental health healthy. Then, there's your family health, basically not just targeting the health of a single individual but the health of the whole family, like childbearing, child rearing, how to take care of your child, as well as how to take care of yourself while taking care of the family, what to do when a family member becomes sick. Then disease prevention and control. So there's a locality and there are certain diseases A, B, C that is endemic in that locality. How to prevent that disease and how to take control of that disease. Mental health, like working day to day life without stress, preventing mental breakdown, prevention of accidents like road safety, safety with fire, sharp objects, safety rules at workplace, use of health services like immunization, antenatal care, postnatal care. These are all contents of health education. Basically, what content should there be when you are imparting knowledge about health? You obviously need to mention about the biology of the body. You need to mention about what to eat, what are the healthy options. You need to mention about the things to be done to keep your body and environment healthy, personal hygiene and environmental hygiene, the things to be done not just for yourself but for the family to keep it healthy. What are the steps to be taken to prevent the occurrence of disease, to control a disease that is endemic in your area? Endemic means disease. Endemic diseases are those diseases that are prevalent in your area. How to take care not just of your physical health but also your mental health. How to prevent accidents from occurring, because accidents can degrade your health and take away your life as well. And how to use health services. All these should be mentioned while giving education on health. Now, one of the most important topics under health education: principles of health education, or the fundamental guidelines to be followed whenever you are trying to impart knowledge on health. So, let me explain it with the help of a small story. Let's say you visit a village and you are trying to collect the people of that village in order to impart knowledge on health. What are the guidelines to be followed? First and foremost, you need to maintain good human relationship. That is, you should have a good relationship with the people of the village so that the people of the village, they trust you and then they listen to you. Now, what you do is organize a meeting so that you can talk about health, provide knowledge about health, and then call the members of that village to attend that meeting. Obviously they are not going to come because they don't really have a certain level of respect for you. It is difficult to gain respect from normal people. They only respect those who are at a higher level of power. So what you can do is you can call someone important from the village, maybe you yourself, and then a headmaster from the village. What happens is that the people of the village, they obviously respect the headmaster of the village, and if they see that the headmaster is present in the meeting that you are conducting, the people are going to follow and then come to the meeting as well. So leaders, so you should accompany some leader with yourself, so that the village people, they at least come to you to listen to you. Then you need to also motivate the people of the village to come listen to you. How can you motivate them? You can motivate them by awakening their desire to learn. For example, you approach the people of the village, increase their interest by talking with them about their health condition, about the health condition of the village, about the status of the healthcare in the village. All this stuff will increase their desire to know more about stuff from you. They will think that you actually are knowledgeable, and maybe the things that you say will be helpful to them. That way, the people will be motivated. And even if one single person is motivated, this single person will call other people of the village and motivate other people of the village to come and listen to you. Till now, all you have done is attracted people to come and listen to you. First, you showed healthy relationship with the people of the village. Second, you accompanied some leader with yourself so that the village came because they know that there is someone in the meeting that they respect. And then you also motivated them to increase their desire to learn. Now, you are there. That important person that you called is also there. The other people of the village are also there to listen to you. Now, instead of just giving information after information after information, you should try to make the people participate in the meeting instead. So the people of the village should themselves find the problem and also find the solution to the problem. Increasing their participation will make them feel important in the meeting as well. Then obviously you are not just going to keep quiet, you are going to share your knowledge as well. Everything thing you say should be credible. If out of 100% things that you say, even 1% is wrong or come out to be false, then the 99% of the things you say that is true won't have any value. So you must be, the things that you say must be credible, so that you are taken by the people of the village as someone who is trustworthy. Then you should not just start talking about any health situation. You should talk about that health situation that is most relevant in that particular village. It is then will the interest of the people rise as well. Let's say you go to a village where gastritis is the major problem, but then you start talking about AIDS. Obviously, the people are not gonna listen to you. They are slowly gonna leave the meeting. For you to gain their attention, to gain their interest, you should talk about what? You should talk about the felt need of the village. Then the things you say must be comprehensive. That is, you should use such a language that is understandable as per the educational status of the people. For example, let's say you are talking to someone who is illiterate. You have to use really simple words. You are talking with someone who is fairly educated. You can use comparatively complex language. Maybe you are talking with a fellow doctor, then you can even use complex terminologies. But then you can't just start spewing terminologies in village. They are not going to understand and then leave you. How can you make your language comprehensive? By going from known to unknown. That is, first you should start with stuff that are easy or understandable by the village people themselves, then start moving to difficult stuff or newer stuff. Like if you're talking about gastritis, first start with what exactly is gastritis, what exactly do the people know about gastritis. Then you can move on to maybe medication, preventive measures, treatment measures related to gastritis. Learning by doing. Let's say you are teaching the people how to purify water because the water that comes in the village is pretty bad. So you should not just be doing the method and showing them. You should make the people participate as well. Let's say you are making you are using uh, distillation, the process of distillation. Call a village member to perform the process of distillation so that they will remember it for the rest of the time. Reinforcement, not just give them one option. Why just distillation? Filtration, use of chemical compounds. Call villagers to do all of these methods. They will at least remember one of many. Feedback, after you have talked and talked and talked and talked, after the villagers have participated, at the end feedback is necessary. Either the villagers are pretty satisfied or neutral or they are not satisfied. Feedback is important because feedback will allow you to change some things that you say, and changing some things might increase the number of people that are satisfied with the things you say. And finally, setting an example. Let's say you are talking about not smoking, the harmful effects of smoking. After you have done the meeting, 5 minutes later, you are there under a tree smoking. The people of the village are gonna see you and then already start judging you. They won't trust you at all. Anything you say won't be trustworthy at all. So, again, what are the principles of health education? First, maintain good human relationship with the people of the village. Then call a leader of a village so that leader is someone the people respect, so they will come and listen to you. Then motivate the people to come, increase their desire to learn. Then make the people participate so that they are encouraged to learn. Then tell things that are actually true in order to increase credibility and make yourself look trustworthy. Then touch their interest by talking about felt needs. Then make language simple or comprehensive. Go from known to unknown. Talk about things people already know about, then slowly shift to stuff that they don't know about. Then make them participate in demonstrative activities. Then tell them various methods to reinforce ideas into their brain. Then take their feedback so that you can change some of the messages you say. And finally, set an example so that people find the things you say trustworthy.